Hi, welcome back to Universal Interiors. This is Leslie Ingolstead, and I have with me John Tredenik for another visit, and I'm just so excited and grateful that he gets to share with y'all just what he's been through, and just to encourage you to find out some more information. We'd certainly help here in Lakes TV3, but let's listen a little bit more to what John gets to tell us about this amazing hospital and the treatment. And can you tell me again, treated for prostate cancer?
Prostate cancer, yes.
And it's in the name of the hospital, please.
Loma Linda is in California. It's in LA.
Okay, and they treat, well, a big part prostate, but
when they developed this proton treatment, they focused mostly on prostate. But proton treatment will also treat any localized tumor. It'll do breast cancer, it will do brain cancer, eye cancers, any cancer that's localized, it can deal with.
And it works on tumors.
It works on tumors.
Okay.
It works on, if you're spread out through lymph nodes and in your blood, leukemia and things, it will not fix that. Okay. But Loma Linda, of course, does any cancer at all.
Okay. So now, this excitement, the treatment of the proton, right?
The proton, yes.
Yes. So please tell us how and what the heck, why is it so powerful, and what is it actually doing to cancer?
The proton, in an atom you have electrons, neutrons, and protons.
Okay.
Electrons and neutrons have no mass, they just have charge. Protons have mass, they are a physical, they have weight. So they get them spinning and they spin off this proton and they release everything else's energy and they trap this proton and they use that it is the same as X-ray or radiation. They radiate you blast your prostate strictly with the proton beam. When a proton hits a target, it can be stopped, whereas electrons and protons, atoms themselves, will go on through and they'll damage everything in their path.
Okay.
With a proton, they can hit your prostate or whatever tumor and stop it right there so it doesn't do damage on the other side. They can also focus it down to the head of a pin so they don't have to blast a big area and hope they get what they're after. They can focus right in on. Now, when the proton hits, it damages healthy cells, but they will heal.
Okay, because that's the way we're made.
They will fix themselves.
Okay.
It will also damage cancer cells. They will again fix themselves. The difference between a cancer cell and a normal healthy cell is a normal cell will not reproduce, but a cancer cell will reproduce, and that's what cancer is all about.
Right.
So once the proton hits this thing and damages the cell, it tries to reproduce. It goes through meiosis. At that point, it dies. It cannot reproduce as it wants to, and so it kills itself.
It kills itself.
It's suicide.
Nice.
Nice.
To cancer, yay.
Yes.
That's amazing. Okay, so you had said they treat those are your main, but you can go into the hospital, and it's a children's hospital.
It's a children's hospital.
And so you were there actually in treatment with kids. You were coming and going.
There were kids in there. They weren't many kids doing prostate. That's usually older people. That was all a bunch of retired guys like me that...
Yeah. But you said, it wasn't like the facilities offered you a workout room.
Everything.
Yeah.
Loma Linda is also a university. They do medical...
Is it called that? Is that the name of the university?
It's Loma Linda University. It's owned by the Seventh-day Adventists.
Okay.
And they own the university, and they do train doctors. They train theology. It's a university.
Okay.
But they have a hospital as part of their university, and they have, of course, all the facilities, libraries, cafeterias, workout centers, recreation facilities. When I went there, they said, this is all yours, use it. This is all part of the deal.
And they were also going to try to work on you as far as the health. I mean, the dietary thing, right?
They have a dietitian that works with you every day.
Okay.
Well, not every day. She will every day if you want. It's every week. You go and see your doctor and you see your dietitian.
Okay. Okay. And
they want to keep abreast of what's happening with you. With me, not much happened. I was pretty much unaffected by any of this except that it cured it. It cured me.
Amazing. And like you said, during that time, we shared about that on our last visit, that you were able to go off and work construction for a weekend. I mean,
I could do anything I wanted to all day, every day. My appointments were at 6:20 in the morning. It took me 60 seconds of treatment. It took probably 5 minutes to get into a hospital gown, do the treatment, and back out again.
And it's just one focused minute, basically.
Yes, one focused minute where the machine was actually shooting a beam through me into my prostate.
Okay.
Yes.
So out of this whole take, you are right now, I understand, our local doctor. He's getting a big old rundown, and you're sharing what you can with him.
Of course, everybody's
and we
a
want,
little
like, take a look
incredulous. They're like, you're still walking
minute.
around, you're still out here able to work, you haven't lost your hair. I do lose some now and then, but I think that's just because I'm almost 70.
Perhaps
I'm supposed to lose some stuff.
Some of that.
Yeah.
Okay, so it's exciting. You're getting out, and that's why we're so thrilled here at Lakes TV3 that you came on, and we're going to tell the neighborhood a lot, actually, in this last few shows. Is there anything that you'd especially would like to get out besides what you are telling us?
I really, every time I get on one of these, I want men to know they do not have to follow along like a bunch of sheep to slaughter. There is another opportunity out there, an alternative that you can go to if you can afford to leave home for a few weeks.
Right.
And they do get it down to 4 and 5 weeks. I did the long-term thing, which is actually 9.
Okay.
But you can do less. You just have to be able to take some time.
So in all of that, I mean, attitude has to come in because you're a positive kind of a guy.
Well,
I mean,
attitude helps a lot, but if you go to Loma Linda, they're going to work on attitude.
They do.
They work on everything.
Sweet.
If you
That's
go
'cause you're
to if you go to
all knit
Mayo or you
together.
go anywhere else, they're going to take you in for 60 seconds a day and send you home. Yeah. At Loma Linda, you're there. You're part of the program. You go to. I went to lectures. I went to tours of museums. I toured the medical facilities. You can go into the children's hospital and talk to kids, and I mean, it's very depressing. Both. I mean, you hate to see sick kids,
right.
But they are healing them. They're doing operations on babies in the womb. I mean, this is an amazing place.
So
just
cool.
truly amazing.
I know you're such a cheerleader of it.
But they get you into their program. They have help sessions. They have. I never felt I needed help sessions, but I went to them and picked up the crowd
a little bit.
Yeah.
So even in babies, there, in the womb.
Right. In the womb, yes, in the womb they will operate. They've replaced
wonderful.
hearts. They were the first ones to put a baboon heart into an infant.
Get out.
It only lasted for a few days.
Okay, so I don't know, John,
did.
if you had told me or told us yet, who brought this up? Was one of the local doctors, or was it somebody that had stepped through
I was doing my health care through the VA system.
Okay.
And when they gave me the options, I said, those all sound horrible. I'd like to go do a little more research. I went to my family doctor.
Okay.
And he said, I have patients who have done this.
Oh, okay.
And you should speak with those folks if you can. If you can. If you can't find them, I will call them and ask them if they would talk to you. But I did talk to patients that had been there before.
Okay.
And I have been there before. Anyone who's going to go through this
for sure.
can call me. You may not get me to shut up. I may just keep on going. This is too marvelous. It's really good.
I am so grateful that you tune in and watch us here at Universal Interiors, and I think you are encouraged if anybody like I am listening to John. His story is out there now, and like you said, we'd be very happy here to let you know how to get a hold of him. And again, thank you so much for tuning in to Universal Interiors. Thanks again, John Trinidad.
Thanks for having me here.